Have you been diagnosed with breast cancer? Or has someone you love been diagnosed? If that is the case, it is likely you or your loved one will need to make a decision about surgical treatment. To come to a decision, there are 5 basic questions you must ask. Some will be directed to your primary surgeon, while some would be to yourself. In this video, I will go through the 5 questions that will be crucial to the choice of surgery type and also your well-being and survivorship. Let's begin. The first question to ask would be the estimate size of the cancer based on imaging. Is it smaller than 4 centimeters? This is the starting point for determining if a patient is a candidate for breast conservation treatment. As you know, breast conservation treatment is a combination of cancer removal, referred to as lumpectomy, with radiation therapy. This contrasts with mastectomy, which is the surgical removal of the breast. Why is it important to know the size of the cancer and if a patient might be a candidate for breast conservation? In the year 2014, this article was published reporting the results of a large study which evaluated population data from the Surveillance Epidemiology and End Results database. The analysis demonstrated that women with cancers 4 centimeters in size or smaller who underwent breast conservation treatment had better survival outcomes than women who underwent mastectomy. There are many other large studies showing similar outcomes, and you can find out more in my other videos. Please check out the links in the description below. The next question to ask the patient is her bra cup size. The size of the brassiere that you wear determines the breast tissue volume a surgeon has to work with, and he or she will be able to assess the tumor to breast tissue volume ratio. This ratio helps the surgeon decide on whether to perform standard conventional breast conserving surgery or if it would be necessary to apply certain special surgical techniques like oncoplastic procedures. Oncoplastic breast surgery is a collection of various surgical techniques to provide a good cosmetic outcome after cancer removal. In general, if the tissue loss is expected to be less than 20% of the entire breast volume, it is possible to perform a less complex level 1 operation, which means only the affected breast needs to be operated on. If the tissue loss is expected to be between 20 to 50% of the breast volume, surgery on the opposite uninvolved breast may be recommended. So the tumor to breast volume ratio influences the suitability for breast conservation and the surgical technique used. The third question is about yourself. Do you have any prior medical history of radiation? Or have you been diagnosed with inflammatory breast cancer? If so, breast conservation treatment may not be suitable. If you do not have any medical condition which precludes breast conservation, then the 4th basic question to ask your surgeon is what his or her recommendation would be in your case: breast conservation treatment or mastectomy. There are variations in mastectomy rates depending on practice and treatment location. Published in the year 2013, this study by a team of doctors led by Dr. Brooks from the University of Iowa found that there is variation in mastectomy rates across various zip codes in the United States. After rigorous and sophisticated statistical evaluation, this team of doctors found that an increase in mastectomy rates by 1% was associated with a reduction in the 7-year survival rates by 0.1% in certain breast cancer patient populations. So this study provided evidence of a variation in mastectomy rates in different practice locations, which potentially could affect post-treatment survival rates. Here is another study demonstrating differences in surgeon practice in regards to breast cancer surgery. This team of doctors found that surgical treatment recommendations between surgeons was discordant among 12.1% of patients who sought a second opinion. Based on the data just presented, if you have a cancer smaller than 4 centimeters in size and have been advised to have a mastectomy, you may have to ask yourself if you would seek a second opinion. It is my strong belief that wherever possible, even in situations where success rates of breast conservation is considered borderline, an attempt at breast conservation treatment should be made. Why do I say that? What evidence supports this belief? Let us look at the available data. This study conducted by doctors in Denmark showed that the highest 10-year survival rate is among women who underwent successful breast conservation treatment. Next highest is the group who underwent an attempt at breast conservation but eventually required a mastectomy for medical reasons. The group with the poorest survival outcome was for patients who were primarily assigned to mastectomy. So, an attempt at breast conservation, even if unsuccessful, may confer better survival. In my opinion, that possibility of better survival in the long term is worth the try. I am not able to present the vast array of studies which support the use of breast conservation treatment in this video. However, the evidence is summarized by this panel of experts who convened at the 2025 edition of the St. Gallen International Breast Cancer Conference. In their companion article, they stated that patients with early stage breast cancer should be advised that breast conserving surgery and radiation therapy is usually the best treatment option with comparable or superior cancer control results, less morbidity, fewer complications, and favorable patient reported outcomes compared with mastectomy. So, in summary, the basic questions for women diagnosed with early breast cancer should be first centered around whether she is eligible for breast conservation treatment. There are tumor, patient, and provider factors which should be carefully considered. I am an advocate for breast conservation because there is robust data supporting comparable, if not superior, cancer control outcomes with breast conservation. It is my fervent hope that by sharing this information, women with breast cancer will have better cure rates and improved quality of life in their survivorship. Thank you for watching until the end of this video. If you found the information helpful, please like, share, comment, and subscribe. If you wish to have more details and a personal discussion regarding the articles cited in this video, please submit a request in the link provided below. There are other domains to consider when making treatment decisions for breast cancer surgery. We will explore and uncover these in our other videos, so stay tuned. Until we come together again, take care.